All right, hello everyone. Thank you for joining my short training video today. So I will be discussing the prevalence of OSA within our population, how to recognize its signs and symptoms, and why OSA causes reduced FRC, otherwise known as functional residual capacity. So what is OSA? As I'm sure we all know by now, OSA stands for obstructive sleep apnea. Defined, it is a sleep disorder in which breathing repeatedly stops and starts during sleep due to blockage or collapse of the upper airway. These partial or complete blockages of the airway are usually due to an overly relaxed tongue and or large neck, as well as those with a small or retracted chin that can all cause OSA. So, how to recognize signs and symptoms of OSA? These are some of the most frequent signs and symptoms of OSA, like loud chronic snoring, pauses during breathing with gasping, morning headaches, frequent awakenings, falling asleep easily during the day when you're like at a meeting or behind the wheel of a car, places where you shouldn't be falling asleep unexpectedly, morning confusion, and also eventually just lead to things like high blood pressure. So let's take a look at the effects of OSA from a clinical standpoint. So to the left of our screen, let's talk about repetitive airway collapse, which is all part of OSA. So in repetitive airway collapse, airflow is reduced or blocked, as we mentioned in the previous slide, by anatomical anomalies. So when that happens, oxygen levels in the blood drop. That lack of oxygen causes the body, or your brain actually triggers your body to awaken, which is why people wake up gasping for air, because the body's trying to get you to breathe so that it can get in the oxygen that it needs. And so that constant disruption of sleep and reduced oxygen to the body eventually leads to more serious conditions like high blood pressure, as I mentioned, heart disease, and stroke. And then speaking about reduced functional residual capacity, that defined FRC is volume of air remaining in the lungs at the end of a normal passive exhalation. Many patients who have OSA are overweight or obese. That extra weight tends to push um, against the chest wall from the abdomen to the chest wall, and that diminishes lung expansion in and of itself. And that reduced lung expansion is most notable in the dependent regions of the lung. Chronic upper airway obstruction can lead to increased airway resistance over time. That really also leads to small airway collapse, and that also hinders the inflation of the lungs and further hindering oxygenation to the body. Um, just kind of wanted to go over a few of the questions that I found interesting, the answers to the questions in my survey. Um, Questions like, have you ever been diagnosed with OSA? I found it interesting that everyone who answered the questions in the survey said no, but they answered yes to some of the other questions like, do you ever unintentionally fall asleep during the day while doing things like watching TV, driving, sitting at a meeting? Um, about 27% said rarely, 18% said sometimes. Another question like, do you ever have feelings of shortness of breath when lying flat? Almost 20% said rarely. Do you ever wake up gasping or choking at night? About 9% rarely, and evenly 9% sometimes, which I thought was interesting. So the data from this survey actually seems to correlate or suggest that although participants said they had never been diagnosed with OSA by a professional, it's likely that some of these participants actually may have underlying OSA and just haven't been diagnosed. So if you have any of the signs and symptoms of OSA, just remember, please don't hesitate to reach out to your PCP for evaluation, just to make sure, to rule in or rule out OSA. Um, they'll get you in, do your at-home study or your overnight studies and possibly even a PFT. Thank you everybody for your time, and thank you for watching my video.